the JAMA Network.
Cheryl O'Riordan loves to bike, travel, and volunteer, but a bout with this bacteria, C. difficile, changed her life.
I felt like the lining of my colon was being ripped out. I needed to be near a washroom at all times.
Dr. Stuart Johnson from Loyola University Health System treated Cheryl for her C. diff infection.
C. diff is an opportunistic bacteria, and it can travel down the gut, start to replicate, produce the toxins, and cause the manifestations that we refer to as C. diff.
About 25 to 30% of patients see a return of the infection. However, some patients carry strains of C. diff that do not make the toxins that are responsible for symptoms of infection, in this case, severe diarrhea. These are called nontoxigenic strains.
If that strain can be established in your gut, it will keep out the toxigenic strains. In fact, it may even force out some of these toxigenic strains.
Dr. Dale Girding from the Edward Hines VA Hospital and co-authors looked at 168 patients who had been successfully treated for C. diff and randomly assigned them to 4 groups. 3 of the groups received varying doses of the nontoxigenic C. diff strain. The 4th group received a placebo.
The secret clearly was to get these patients to be colonized with this nontoxigenic strain, which just means that these strains set up housekeeping in the GI tract. We got about 70% of patients to colonize with this strain after treatment.
This study appears in JAMA, Journal of the American Medical Association.
We were able to reduce the recurrence rate from 30% in the placebo group down to 11% for all patients who got the non-toxigenic strain. And for the dose that worked the best, the recurrence rate was 5%.
Administration of non-toxigenic strains did not result in any severe side effects compared with placebo.
It's the first time that we've taken a strain of the same bacteria that causes the disease and actually used it as a preventive measure.
Luckily, Cheryl did not have a recurrence of C. diff. Her health is back to normal, and she is looking forward to
My next trip.
Catherine Dolph, The JAMA Report.